You were talking about some other really important things, though, is that even when the bug, quote unquote, may be gone, the body is still reacting. And so you have to, you're thinking a lot about in terms of, mast cell issues or autonomic nervous system, and you said mitochondria. How do you look at that mess?
Yeah, sure. It's a good question because I'm really excited about a new testing platform we've started working with, and I'm not sure if it'll be the answer to everything because very few things are. But once again, if you combine the testing together, it might be insightful. And that's the IGL labs from Germany that looks at the mitochondria a little bit closer. And it also has some cool toxin assessments, I think, that are also important to recognize and evaluate. So I think if we if we follow models or theories like cell danger response, we see the mitochondria gets wrapped up in that. Your primary energy production system in your body starts to change in one way or another. And it's possible for that system to not entirely recover for several reasons. I mean, there could be less of them now, which can also happen with advancing age. They could change the way, they could fuse together. They could turn into different looking mitochondria. They could morphologically or physically change. There's no way for me to really step inside of your individual cell and just look around physically. But I'm really excited about some of that stuff because if it gives me sort of a model to look inside of your cell and see what's not operating still, I think that speaks volumes, or it could possibly, right? And that can relate to a lot of things. Your nerves, I mentioned autonomic dysregulation, which is largely present in your nervous system, your autonomic nervous system. And guess what? The two areas that have a lot of mitochondria are your muscles and your nerves. And some nerves have an absurd amount of mitochondria. So it could be a connection point for some of these patients too, to really look at that. And we've found over time that mitochondrial therapies, quote unquote, do work better after you've treated bugs or after you maybe detoxed people or something like that. So I think looking at that is something newer. It's not a new idea, but it's just a newer objective tool that we can maybe monitor and then see if we can change that over time. And so if we take that through a staging process, treat the infection, work on the mitochondria and the autonomic function on the other end, and there's obviously a lot of other tools there, that might be sort of a simple model of approach. Now, beyond that, the immune system still often has to recover. And if there's stuck processes there, we will have to sometimes use, different tools for immune modulation. If it's mast cell, it might be mast cell stabilizers. If it's like autoimmune type reactions, we might talk about low dose naltrexone or even the new fun world of peptide therapies, for example, all ways to sort of modulate the immune system and try to get it to recover. And I like peptides too because they have sort of a regenerative feature to them, I think, in terms of they're signaling your system to operate in a way where maybe it's not operating as well or hasn't been for a little while. And then it's also, some of them are really trying to actually regenerate the tissue that has been damaged. So maybe the cellular system, maybe the connective tissue in some people. And that's kind of exciting. So I think regenerative medicine practices, and there's many more of them too, seem like a good idea in some of those stages as well. And beyond that, there's more things I can talk about, of course, like the traumatic response of the whole thing and how that affects the autonomic nervous system. So doing trauma work, doing what they call limbic system retraining, among other things. There's a lot to really unload there, and it's on a case by case, and really, that can take time too. So if you get through phase 1 of treatment of the infection, there may still be a bit of a journey ahead, but that's still progress.